American diet is so bad that diabetes tends to go along with obesity. And
Yes.
obesity is such an epidemic. For the first time, we're seeing type 2 diabetics in children. Symptoms, some of you might have experienced some or all of these: fatigue, weight loss, frequent urination. I see younger diabetics develop cataracts sooner. Your eyelids are here. And when you look in, there's the cornea, which is the clear part, like the window of the eye, and then the retina, what we've been talking about, is this layer. It's like the film of the camera. And this is what we call the lens. It actually sits on inside the eye. And when that gets cloudy, that's what we call a cataract. With diabetes, what can happen is you get kind of like this waxy film buildup on the back of this lens. And it makes it hard for people to see out, makes it hard for me to see in. And so what we'll do is a surgery to remove the cataract. After the surgeon takes the cataract out, a plastic implant that gets put back in there that focuses light on the back of the eye. So that happens a little more quickly with diabetes. But where glaucoma happens is the optic nerve. And basically what I tell my patients is that the optic nerve, when we look at it in the office, actually looks like a bagel. So there's like a cup in the middle. And a healthy nerve has a little cup like a bagel. But as you develop damage to the nerve, that cup gets larger because the tissue is dying. You can't operate to restore vision, but it's thought that pressure develops and then causes damage to the nerve. So what we typically do for glaucoma is lower the pressure, usually with drops. Some patients, if the drops aren't working, need to have a surgery to help lower the pressure. Anybody with suspicion of glaucoma, if they have diabetes, because that's going to make me a little more aggressive in looking into whether or not you have problems with diabetes. The best thing is to keep out of the doctor's office, because what we're doing is to try to play catch up. So if I can convince people to monitor their sugar more aggressively, then that's always a 12.